Your liver could be failing right now, and you might have absolutely no idea. No pain, no warning, no dramatic symptoms. You could feel mostly fine while one of the most vital organs in your body is silently breaking down. That's what makes liver disease so dangerous. It doesn't scream for attention until it's already in serious trouble. And by the time most people find out, they're shocked. In this video, you're going to learn the 7 subtle but terrifying warning signs that your liver is struggling, signals most people ignore, misdiagnose, or never connect to the liver at all. Some of these signs appear years before major damage is discovered. And at the end, I'll reveal the real reason liver disease is exploding worldwide, and how avoiding one hidden food can radically change liver health faster than most people think. The liver is one of the most underestimated organs in the human body. It doesn't get the attention the heart or brain receives, yet it performs over 500 essential functions every single day. It regulates blood sugar, processes nutrients, neutralizes toxins, produces bile for digestion, builds proteins, and manages hormones. What makes the liver especially dangerous when it's sick is its silence. Unlike other organs, it can deteriorate for years without causing obvious pain. Many people unknowingly live with liver dysfunction while assuming their symptoms are unrelated or harmless. One of the most frightening realities of liver disease is how long it can progress unnoticed. A person can have significant liver damage and still pass routine checkups. Blood tests may appear normal, while deeper dysfunction continues beneath the surface. Doctors often wait for advanced symptoms like jaundice, fluid buildup, or extreme fatigue before sounding the alarm. By then, damage may already be severe. This delay isn't malicious. It's a limitation of symptom-based medicine. That's why recognizing early warning signs is critical if liver health is going to be protected in time. The liver is extraordinary because it can regenerate itself more than any other internal organ. Even if a large portion is damaged or surgically removed, it can regrow functional tissue. This ability gives people a false sense of security. They assume the liver is invincible. But regeneration only works if the damage stops. If the liver is constantly assaulted day after day, it never gets the chance to heal. Instead, scar tissue builds, inflammation increases, and function slowly declines until regeneration is no longer possible. SIGN number 1. Waking up between 2 and 3 a.m. One of the earliest and most overlooked signs of liver dysfunction is waking up suddenly between 2 and 3 in the morning. Many people blame stress, anxiety, or adrenal fatigue. Others assume it's cortisol or sleep apnea. But the real issue often lies deeper. During sleep, the liver releases stored glucose to keep the brain fueled. If the liver can't regulate this process properly, blood sugar crashes occur. The brain senses danger and triggers an emergency response. The blood sugar-adrenaline connection: when blood sugar drops too fast during sleep, the brain panics. Unlike muscles, the brain cannot store fuel. It relies entirely on a steady supply of glucose from the liver. To survive, the brain activates adrenaline to force glucose release. Adrenaline is powerful. It jolts the body awake instantly. The result is sudden alertness, a racing heart, and a feeling of being wide awake at an unnatural hour. This isn't anxiety, it's a biochemical emergency response triggered by liver dysfunction. Why treating the adrenals doesn't fix it? Many people spend years trying to support their adrenals with supplements, herbs, and stress techniques. While stress management is important, it doesn't solve the root problem if the liver is failing to regulate blood sugar. The adrenals are doing exactly what they're supposed to do, saving the brain. The real issue is upstream. When liver health improves, nighttime awakenings often resolve naturally without any adrenal-focused intervention. SIGN number 2. Right shoulder and neck pain. Pain in the right shoulder, upper back, or neck often gets blamed on posture, stress, or muscle strain. But when this pain is persistent and unexplained, it may be coming from the liver. The liver sits beneath the right rib cage and is connected to the diaphragm through the phrenic nerve. When the liver becomes inflamed or swollen, pressure irritates this nerve. The brain interprets the signal as shoulder or neck pain rather than internal distress. How bile congestion triggers pain. A damaged liver often struggles to produce and move bile effectively. Bile becomes thick and sluggish, backing up into tiny bile ducts. This causes pressure, inflammation, and swelling. The swollen tissue irritates nearby nerves, creating pain that radiates upward. This is called referred pain. Many people undergo massages, physical therapy, and chiropractic care without relief because the source of the pain isn't musculoskeletal, it's internal. Why this pain is often misdiagnosed. Standard imaging like X-rays and MR may not reveal liver-related nerve irritation. As a result, patients are told their scans are normal. They're advised to stretch, strengthen, or reduce stress. Meanwhile, the underlying liver issue continues unchecked. Understanding this connection allows people to stop chasing symptoms and address the real cause. SIGN number 3. Bruising. Easily unexplained bruising is not just a skin issue, it's often a clotting issue. The liver produces critical clotting factors that allow blood to coagulate properly. When liver function declines, clotting becomes inefficient. Even minor bumps can result in noticeable bruises. People may find bruises they don't remember getting, especially on arms and legs. The hidden danger behind easy bruising. Easy bruising indicates compromised protein synthesis in the liver. This is a sign that the liver is no longer keeping up with its workload. Over time, this can progress to excessive bleeding, slow wound healing, and internal bleeding risks. Many dismiss bruising as aging or thin skin, but when combined with other signs, it should raise concern about liver health. SIGN number 4. Persistent itching. Unrelenting itching, especially at night, or on the soles of the feet, is a classic but often ignored liver symptom. This itching isn't caused by allergies or dry skin. It's caused by bile acids entering the bloodstream. When bile can't flow properly out of the liver, it backs up and circulates throughout the body, irritating nerve endings in the skin. Why liver itching is worse at night? At night, the detoxification processes intensify. Blood flow shifts, and bile circulation changes. This makes itching more noticeable when lying still in bed. Many people assume parasites, fungal infections, or allergies are responsible. They try creams, antihistamines, or cleanses with no relief. Until bile flow improves, itching persists. SIGN number 5. Sudden intolerance to alcohol. A person who once tolerated alcohol but now feels sick after small amounts should pay attention. Alcohol is processed almost entirely by the liver. When liver function declines, alcohol becomes toxic faster. Symptoms may include nausea, inflammation, headaches, anxiety, flushing, or extreme fatigue after drinking very little. Why alcohol becomes intolerable? Alcohol metabolism produces toxic byproducts that must be neutralized by the liver. A compromised liver can't keep up, allowing toxins to circulate longer. This results in amplified negative effects. Many people assume aging is the reason they can't drink like they used to, but sudden intolerance often signals deeper liver trouble. SIGN number 6. Enlarged belly with thin legs. An enlarged abdomen paired with thinning arms and legs is a hallmark of advanced liver dysfunction. This isn't belly fat, it's fluid buildup, a condition known as ascites. When liver pressure increases, fluid leaks into the abdominal cavity. Meanwhile, muscle wasting occurs because the liver can no longer process protein efficiently. The muscle loss connection. Without proper amino acid metabolism, muscle tissue breaks down faster than it can be rebuilt. Legs become thin and weak. This physical pattern is unmistakable in advanced cases. While commonly associated with alcoholism, this condition can occur in people who never drink but consume high amounts of processed carbohydrates. IgN number 7. Brain fog, irritability, and personality changes. The liver plays a major role in detoxifying ammonia, a byproduct of protein metabolism. When the liver fails, ammonia accumulates in the bloodstream and crosses into the brain. This condition, known as hepatic encephalopathy, affects cognition, mood, and personality. How ammonia affects the brain. Excess ammonia disrupts neurotransmitter balance. People may experience brain fog, confusion, poor focus, irritability, anger, and short temper. Loved ones often notice personality changes before the individual does. In severe cases, speech becomes slurred and coordination declines. The real cause of modern liver disease. Contrary to popular belief, liver disease isn't primarily caused by fat, alcohol, or environmental toxins. The biggest driver is insulin overload caused by hidden sugars, especially industrial starches. These refined carbohydrates spike insulin aggressively and overwhelm liver metabolism. What is industrial starch? Industrial starches are chemically processed carbohydrates derived mainly from corn. They appear in processed foods as thickeners, fillers, and stabilizers. Ingredients like maltodextrin, modified food starch, and corn syrup solids are metabolized faster than sugar itself. They flood the liver with glucose. Why even non-drinkers get fatty liver. Non-alcoholic fatty liver disease is exploding worldwide. People who never drink alcohol develop the same liver damage once seen only in heavy drinkers. The culprit is chronic insulin elevation from processed foods. Over time, the liver converts excess sugar into fat, leading to inflammation and scarring. How to reverse liver damage. Step 1. Stop constant snacking. Every time you eat, insulin rises. Constant snacking keeps insulin elevated all day, preventing liver recovery. Eliminating snacks, especially carb-based snacks, gives the liver time to reset and regulate blood sugar naturally. Step 2. Eliminate sugar and refined starch. Removing industrial starches dramatically reduces insulin spikes. This single change can reverse fatty liver in weeks. Read labels carefully. Avoid foods with maltodextrin, modified starch, and refined corn derivatives. Step 3. Avoid seed oils. Seed oils disrupt insulin signaling and promote inflammation. Replacing them with stable fats improves liver insulin sensitivity and reduces oxidative stress. Step 4. Eat high-quality protein. Animal proteins provide complete amino acids necessary for liver repair. Protein supports detoxification pathways and prevents muscle loss. Eggs, fish, meat, and cheese are powerful rebuilding tools. Step 5. Emphasize liver-supporting vegetables. Bitter greens like arugula, dandelion, radish, kale, and cruciferous vegetables stimulate bile flow and detox enzymes. Fermented vegetables further enhance gut-liver communication. Step 6. Prioritize sleep. Sleep deprivation raises cortisol and worsens insulin resistance. Poor sleep directly damages the liver. Deep, consistent sleep accelerates healing. Step 7. Reduce chemical exposure. Choosing organic foods reduces pesticide load, easing liver detox burden. While not perfect, this step lowers cumulative stress on the liver. Step 8. Bile support compounds. Certain bile salt compounds support bile flow and reduce inflammation. These have been shown to improve comfort, digestion, and liver enzyme balance in many cases. Final message. The liver doesn't fail overnight, it fails silently. But the body always sends warnings. When you learn to recognize them and remove the real cause, the liver can heal faster than most people imagine. Disclaimer: this video is for educational and informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. The information presented should not be considered medical advice. Always consult with a qualified healthcare professional before making changes to your diet, supplements, or health routine, especially if you have an existing medical condition or are taking medication.